Good afternoon, guys. This afternoon's topic A discusses how informal caregivers play a crucial role in care for loved ones. Okay, so here we're going to get into that now for discussion. The article highlights the crucial role of informal caregivers, spouses, adult children, and friends who support heart patients at home. Despite their essential contributions, these caregivers often go unrecognized within healthcare systems. The study explores their needs and gaps in education, particularly in cardiac rehabilitation. The author, a scientist specializing in patient education, emphasizes that healing extends beyond hospitals to daily routines and personal care. This article calls for better resources and training to empower caregivers in providing effective support, folks. Second sheet. Would you like more details on the study's findings or recommendations for caregiver support? The article highlights several key needs of informal caregivers supporting heart patients. Education and training. Many caregivers lack sufficient knowledge about cardiac rehabilitation, medication management, and post-hospital care. Emotional and psychological support. The stress of caregiving often leads to burnout, anxiety, and depression, which are frequently overlooked. Okay, then there's recognition within healthcare systems. Caregivers play a vital role in patient recovery, but are not always included in medical decisions making or provided with adequate resources. Practical assistance. Many caregivers struggle with daily tasks like monitoring symptoms, maintaining dietary restrictions, and coordinating medical appointments. Community and peer support. A need for more structured support networks where caregivers can exchange experiences and advice. Would you like to delve deeper into any of these areas? Perhaps exploring practical situations or available programs, including caregivers in healthcare. Decision is essential because they play a direct role in a patient's recovery and well-being. Here's Improve community of care. Caregivers often manage day-to-day health needs, ensuring that medical advice is followed correctly. Better patient outcomes. Research shows that when caregivers are involved, patients tend to have fewer complications and better recovery rates. Reduced caregiver burden. When caregivers are acknowledged and trained, they experience less stress and better equipped to provide effective support. Stronger communication. Healthcare teams benefit from caregivers' insights into patients' habits, symptoms, and responses to treatment. Empowerment and dignity, including caregivers, fosters collaborative approach where both patient and caregiver feel supported rather than isolated in their roles. Your interest in self-directed care models aligns well with this discussion. Would you like to explore how some states structure caregiving or caregiver involvement, especially in models like agency with choice? Caregivers play a crucial role in healthcare, particularly for individuals recovering from heart conditions, managing chronic illnesses, or aging in place. Their responsibilities span multiple areas. Medical support. Caregivers help with medication management, symptom monitoring, and communication with healthcare providers. Many also assist with post-surgical care or therapies. Or therapy exercises. Daily living assistance. They help with tasks like bathing, dressing, meal preparation, and transportation to medical appointments. Emotional and social supports. Caregivers provide companionship, motivation, and emotional stability, reducing feelings of isolation for patients. Advocacy in healthcare decisions. They often bridge communication between patients and providers, ensuring care plans align with the patient's needs and preferences. Okay, care coordination. Many caregivers manage scheduling, paperwork, and insurance concerns to streamline the patient's experience within the healthcare system. Since you've explored models like agency with choice and self-directed services, would you like to delve into how these approaches empower caregivers and improve patient autonomy? Caregivers in healthcare face a range of challenges, that can improve, impact their well being and effectiveness. Some of the most common difficulties include emotional and physical strain. Caregiving often leads to burnout, stress, and exhaustion, especially when managing complex medical conditions. Lack of training. Many caregivers, especially family members, receive little formal education or medical care. Making these tasks like wound care or medication management overwhelming. Financial burden. The cost of the cost associated with caregiving include loss of wages and medical expenses can be significant. Time management struggles. Balancing caregiving with personal responsibilities, work, and social life can be difficult. Social isolation. Caregivers often experience loneliness due to the demands of their role, limiting their ability to engage in social activities. Conflicts in care decisions. Um, Disagreements with healthcare providers or family members about treatment plans can add stress. Health risks. Caregivers may neglect their own health, leading to sleep deprivation, depression, and chronic stress. Since you've explored self directed services and agency with choice, would you like to discuss how these models address caregiver challenges and promote autonomy? Caregivers in healthcare face a range of challenges that can impact their well being and effectiveness. Some of the most common difficulties include emotional and physical strain. Caregiving often leads to burnout, stress, and exhaustion, especially when managing complex medical conditions. Lack of training. Many caregivers, especially family members, receive little to no training, folks. Formal education on medical care, making tasks like wound care or medication management overwhelming. Healthcare risks. Caregivers may neglect their own health, leading to sleep deprivation, depression, and chronic stress. Since you've explored self directed care services and agency with choice, would you like to discuss how these models address caregiver challenges and promote autonomy? Caregiver burnout can significantly impact patient care in several ways. Reduced quality of care. Burnout leads to exhaustion, making caregivers less uh, um, attentive and increasing the likelihood of mistakes in medication management or symptom monitoring. Emotional detachment. Overwhelmed caregivers may struggle to provide care, guys. Emotional support, which can affect a patient's mental well being, higher risk of hospitalization. Studies show when caregivers experience burnout, patients are more likely to have emergency room visits due to delayed or inadequate care, neglect of patient needs. Burnout can cause caregivers to unintentionally overlook important aspects of care, such as hygiene, nutrition, and mobility support. Increased caregiver health issues. When caregivers neglect their own health, they may become physically or mentally unwell, further complicating their ability to provide effective care. Since you've explored self-directed care services and agency with choice, would you like to explore? Would you like to dis, would you like to discuss how these models help mitigate caregiver burnout and improve patient outcomes? Okay. Okay, guys, so that's A for you. I'll be back on with B shortly. Give me a little bit for B, please, and I'll be back on with you. For now, Gator Wellness, take care, folks.